Welcome everybody to another episode of Career Diaries by Elemed, the podcast day. Sorry, let me start again.
Sorry.
Hello everybody and welcome to another episode of Career Diaries by Elemed, the podcast dedicated to talking about careers in the medtech industry. And today I'm super excited to have Marissa Fayer on the program. So Marissa, you're a serial entrepreneur, and she is the founder and president of Fayer Consulting and also the CEO and founder of HERHealthEQ. Marissa, in your own words, maybe just say a couple of things about who you are and what you do.
Yeah, absolutely. So, I'm the president of a consulting firm, which is always the day-to-day and keeping the food on the table, certainly in New York City. And it's really great to be part of like innovation and new companies and things like that. And then I'm also the founder and CEO of HERHealthEQ, and we are a global social enterprise nonprofit. And we focus on women's health in developing countries. And so we provide medical equipment to developing countries focused on women's health, non-communicable diseases. And we work with a lot of the medical device community, a lot of the medical device companies, and take some of their excess repurposed equipment and get them to the places that need them the most. But I'm also recently a venture partner at Sidui Capital. I'm on the board of 3 companies: Wellways Medical, Deep Look, and Precision Medical Devices. But, I'm just kind of the person who was, and I guess still am, an engineer. I want to make changes in the world, and I'm a huge advocate for health equity for women.
Love that intro. So I have a bit of a random question for you, because I was obviously having a look at some of your YouTube stuff, your YouTube videos, and I came across an interview where you said, originally I wanted to be an astronaut. So talk to me. Let's just rewind all the way back to the start of your career. How do you go from wanting to be an astronaut to actually then becoming an engineer in the medical device industry?
Yeah, not as random as you think, maybe. I've always wanted to be an astronaut, and so I grew up in the Sally Ride era, and my parents were so helpful. And really encouraged my dreams. So that was great. I went to space camp and space academy multiple times. I studied science and engineering and math, even in high school. I was always just very good at it, and I loved it. And I was curious. And so I went to school, actually university, for aerospace engineering. So I started there, and then it was very theoretical. I was never making the astronaut corps because back then I didn't have perfect vision. They wouldn't accept corrective surgery many, 20, 25 years ago. So, and so I just was kind of trying to figure out what I should do. And I switched over to manufacturing engineering because it was very hands-on and very real life. And I thought I was going to go into the aerospace industry. I interned for several aerospace companies. And I was talking to a professor of mine, and he said, I don't understand why you wouldn't go into the medical industry, because it's always new, it's always innovating, it's always changing, and you're helping people. And, I was like, oh, okay. And then, I thought about it. A company in the medical device industry made me an offer right out of university. And I did that. And that was history. I think like you stay in an industry that's really exciting and interesting and innovating. And that's exactly what I did. And I just never left because it's new. Every day is like something new.
And something that I love about the medical technology industry is one of the reasons that I started to recruit in medtech was just that there's just so much variety, like from company to company. There's so many different types of technology in different areas doing different things. And the innovation is so broad that there's always, as you said, there's always something new and cutting edge that's coming out that you're like, wow, that's an incredible piece of equipment or an incredible product, or that's really dramatically impacting lives and doing good stuff in the end, right? Which is kind of like one of the big things of being in the healthcare industry, the value that you add and the lives that you change by being part of this industry.
Yeah, I was very much part of, I was, one of the lead partners in developing the first 3D mammography system. And I
Wow.
brought it, I was the one that brought it into manufacturing for the first time, wheeled the first one off the manufacturing line. Like, that's new innovation that is part of the medtech industry. I've been part of so many new product launches, and not just iterations on new products, like significant new products to the market. I've been part of mergers and acquisitions for years, which is bringing new innovation into sometimes an established larger company. And it's so true. The industry in med tech and medical devices just always changes. There's something new, and especially recently, quite honestly, there's even more innovation happening, and I think that's really exciting because everyone's understanding that iterating on the past and iterating on a new color, a new design, one little tiny feature is not a new product.
Mm.
And there's a desire for new products and innovation out in the market. And that's why I feel no need to leave the industry.
Mhm. So on that point, what are you looking at in terms of like big trends in 21 in terms of medical technology? What's caught your interest?
Yeah, so I really can say that it's going to continue this digital health platform, which is great, which was kind of up and coming for a while, but now it's I mean, everyone now understands it because we've all been digital for at least 10 months now.
Yeah.
And so that's really big. I think that there's a lot of innovation that's going to start happening around what actually matters. There was no innovation that happened in ventilators,
Mm.
which is such a, it's not a simple device, but it's something that's necessary. There was never any for 10 years, 10, 15 years, there's never been innovation, by and large around it. Now everyone knows what a ventilator is, unfortunately. And so things like that, there's going to be innovation. And a lot of these hospitals and a lot of these doctors are going to start really being choosy about what they're looking for, and if they're actual solutions. And they're going to kind of, I hope, push back on some of these medical device communities and companies to say, no, 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 this is what we need, and we
Mm.
need your help to do it. I think faster, smarter, better is always going to be a trend. I think a lot of people are going to start to look at how we can also develop for the rest of the world. And there's some innovations that are happening and that are launched in Latin America, that are launched in Africa, that are far more state of the art than they are in the US or Europe. And so I think there's going to be a lot of innovation that's going to happen around, okay, what do we actually need? And what's going to help the patients, as opposed to what just looks nice.
That's so interesting because these are areas, that we're starting to see kind of, they've been kind of, people have been talking about that stuff like digital health, but I think with COVID we've just seen it, really explode, and it's exciting to see the future. And I think you're absolutely right. The companies that really can understand what your user needs, or what the patients needs, or what the doctors needs in order to be more effective, I think they're going to be the ones that win. But in terms of disruption, it's so interesting, but I think sometimes the biggest innovation comes from companies that aren't in medical devices,
True. So
uh,
true.
and especially in that digital space, we're seeing a lot of like tech companies moving into medical devices, as opposed to medical device companies moving into tech, if you see what I mean, right? It's more kind of like
Yeah.
coming from, because you've been part of a lot of mergers and acquisitions, and what's been your take on that?
Yeah, and so there's also, it's really another interesting trend within a large medical device company, is that they're setting up these venture arms.
Mm.
And so these venture arms are then going out and finding these small medical device companies or small tech companies, and almost trying to bring them into the large company, because they have the larger companies have distribution, they have the sales, they have the support, they have the capital as well. And so that's the way some of these larger companies are trying to innovate, through smaller mergers and acquisitions, but also through these venture arms, which is fostering innovation. And not all of them are going to make it, but it fosters innovation and change. And so that's one thing. There is, there's tech companies that never thought that they were going to be a medical device. There's a lot of them that have started out in the consumer goods space,
Yeah.
and then they're getting into medical devices. So like a hydration monitoring system. And, yeah, it's a CPG, it's great for athletes. And then, hey, by the way, there's no more competitions in 2020. So what are we going to do? We're going to pivot to a medical device because it's great for hospital systems and longer term care system, facilities. And so a lot of people are starting to think like, how can my tech be implemented in the medical device world, in the medtech world, in the healthcare space? And a lot of these hospitals are also trying to figure out like, oh, okay, we could probably use that. It's not traditional, but we could. And so it's definitely a trend. It's one that's been happening for a little while. And now I just think it's going to start fast tracking and accelerating. And it's really interesting because out of any major issue that happens in the world, so there was the recession, there was 9/11, now there's the COVID crisis. So out of all of these crises, and we can look back in history and see this too, after all of these crises, there's a huge surge in innovation.
Mm.
I mean, most people didn't hear about Zoom until March. I've been using it for 5 years because it works great internationally. But like all of a sudden you can do all the things, digital education. Everyone was like, no, we're never going to need digital education. Now we, of course, need it. And now, like, there's a lot of interesting new innovation that'll happen. I mean, it's simple as in only in cities did we ever have delivery service for our groceries. Now everyone's having that. And same thing with the healthcare. I mean, these pharmacies have now all of a sudden, every single pharmacy in every region has been delivering care, has been delivering medicine. That was just not norm. And there's different ways that doctors are now seeing patients. Doctors were very resistant to this, and there was only a few times that and select doctors that would want to do telehealth. There is no question anymore. Listen, we're always going to need some sort of on the ground innovation, and so and on the ground care for a lot of things. I mean, you can't do a surgery remotely. You physically need to get into the body, but you might be able to do this, and this is what the developing world has really tried to pioneer and has been relatively successful, is that yes, you have a doctor, he or she might not be the expert, but you have somebody remoted in teaching the doctor what to do and overseeing that remotely. And you don't need to have a tiny, every specialty and every doctor in every hospital in a remote region. You need the connection so that somebody who is highly trained can explain it, train them, and then oversee surgeries remotely. And it saves a lot on costs. It saves on time. It saves patients' lives, and that's what's really important. So, yeah, I'm excited. I'm starting to see some of the innovation now, and a lot of companies have also started to pivot, which is very exciting to see. And they're pivoting to technology and innovation that matters. That matters to people. And I think that's always the most important thing that innovation should be serving.
And I think like something that comes through so strongly when you're talking is just your passion for kind of like what you do and this sense of purpose. I got that as well when I was watching your TEDx talk that you did in Switzerland. And this is something I really wanted to bring out on this episode with you, this idea of kind of like passion project and purpose. So talk to me a little bit more about what you see as your purpose, and then how your whole story around how you set up your nonprofit.
Yeah, absolutely. So my passion found me at a bar in Costa Rica. So I was not looking for it. I knew that I was missing something, but it was just like it kind of came to me. It's not something I've worked on my entire life. As we talked about before, I wanted to be an astronaut. I never thought I was going to be a champion in women's health. I was always passionate about women. I was always passionate about health. I was always passionate about, education for girls. And so those are things that were important to me. And so I just realized that I can put all of them together. And so what happened for me was a conversation in a bar in Costa Rica changed my life. And it's when I figured out, or was told actually, that women in a certain region were dying disproportionate to the rest of the country. And it was because their mammogram machine broke down. And, I was very cavalier at 30 and said, well, that's, we make, like, my company makes those. So why can't we just get you one? And, at 30, you can be very cavalier, or at any age, you can be very cavalier, but, especially when you're younger. And I can, like, I worked with a lot of different stakeholders and facilitated that donation. And it just got me thinking, well, there must be other medical equipment that's in the same situation. There must be other health needs. And for me, it all came out of, I want girls who are passionate and interested in science and technology and STEM.
Mhm.
I wanted them to go to school. But they weren't going to school because their mothers, their grandmothers, their aunts, their sisters, they were sick. And so the girls are pulled out of school first in developing countries. Being in the medical device industry, I have access to equipment to make sure that they're not, sick, and so that they are healthy. So that was how I'm, like, this is literally how I'm fixing the situation of girls being able to go to school, because it's still something I'm passionate about. But there are very few organizations that are focused on women's health in developing countries. And so I knew that I wanted to be one of those. And so I founded HERHealthEQ several years ago. And what we do is we work with medical device companies, take their returned product, which, by the way, is returned from hospitals every 2 to 3 years because they want the new innovation, which makes sense. But this equipment, we're talking about ultrasounds, mammogram machines, EKG machines, dialysis equipment, things like that. It has a 25-year lifespan at least. And so there's no reason to throw that in the trash. And a lot of times these companies, they refurbish them and they resell them to lower cost markets. And that's exactly what they should do. But there's an excess that sits around, and that after a few years, it just gets thrown away.
Mhm.
Thrown away, donated, put in a warehouse, et cetera, and it just gets lost. So we work with medical device companies to take that equipment and deploy them systematically and programmatically with care and impact to developing countries that focus on women's health. And so, we've placed ultrasound machines in several different countries. We do cervical cancer testing, screening, and diagnostic and treatment. We have breast imaging in several different locations. We focus on maternal health with ultrasounds as well, and we continue to expand into dialysis and heart disease and so many other different issues that affect women. And it depends on each country and each region and each doctor. So we started as a traditional nonprofit, and we recently have shifted away from the traditional give everything away for free, because it's not a sustainable model, which in today's world, everything should be sustainable as well. And that means a company being sustainable. And so it creates, we are a revenue generating nonprofit, which means, we oftentimes sell the equipment for a lower cost than a traditional distributor, but we're also providing the support that these hospitals and clinics need. So we're making sure that the equipment is serviced for many years. We're making sure people are trained and it's installed correctly. We're also checking up on them and working with them to make sure that they're seeing patients, because that's really important. The reason we do what we do is to make sure that people are seen and that they're treated and diagnosed. And these are places where we take it for granted in the developed world, where we go every year for a doctor's appointment. And a lot of these people are either going for a doctor's appointment, twice in their lifetime, or when women are having babies. And that's when it's a great time to capture a lot of this information and capture their attention that health is really important. And it's not just the health of their baby, it's the health of them, because they need to help provide for their families. And again, they need to send their kids to school. And that's what they want to do. There is no mother, or very few mothers in this world that don't want their children to have a better life than they do. But we need to make sure that the women are healthy so that they can work, they can have a living, they can provide for their family, they can send their kids to school, they can be the ones that change the world, and that they can be the ones that send their kids, especially their girls, to school to change the world. And that's really why we do what we do. The conduit to that is medical devices. And the reason I focus on it is because it's the industry I knew. It wasn't some miraculous observation and I figured it out. It was putting pieces together, which is what every good engineer does. You just put pieces together and figure things out. And so I figured out that I can solve this by this solution. And it's going to look different. Somebody else would have come up with a different solution. And this just happens to be the one that I figured out for the sole reason I was lucky to be in the industry.
It's so fascinating as well, because when you explain what obviously the company does, it's kind of like a no-brainer, right? You kind of, it's that moment where you're like, why hasn't somebody done that before? Or like, why does that not exist already? It's so, it feels like it's so needed and is a no-brainer that would be created. But when you kind of had the idea and you were like, okay, well, I could probably put something together that could kind of deal with this problem. Did you ever have any kind of like self-doubt or like, wow, this could potentially be really big? Like, how did you know to actually go for that?
Yeah, so I have self-doubt every day, just like every entrepreneur does, for sure. And if they don't, then they're not innovating enough, quite honestly. There are companies that do this. They don't focus on women. They don't focus on non-communicable diseases, and they're not specific. So there's definitely companies that take excess equipment and then fill up a cargo ship or a container and ship it over to another country, and it's moving waste around oftentimes, and that's not what I wanted to do, because 70% of medical equipment that gets donated winds up in the trash within a year. And that's just not, again, we talk to sustainability. That's not sustainable. You're just moving trash from one country to another. Yeah. And that just doesn't make sense to me. But I mean, I think I just went for it because I, it's something I was passionate about. There's no reason I have self-doubt, as I said, every single day. I just keep plugging through because it's not about me. None of this is about me. I'm, again, a conduit to make sure that women who don't have access to equipment do have access to equipment. If that means that, I'm speaking on a podcast or I'm giving a TED talk or I'm doing, I'm advocating for them, that's because I have a platform and a voice to be able to do that. And that eventually I want them to do it. Mm-hmm. And so the reason I do what I do is because of them, because of the women who don't have this access, and they're the ones that are going to change the world. I'm just going to help them get healthy. Mm-hmm. And that's, that's, I think about that every day where I'm like, oh, I'm done. Like, this is too hard. You know what? Every time one woman is treated or saved or, or diagnosed with something that can be treated, that makes me keep going. And that's the importance of what we do. And, we're not probably scaling as fast as I would like. As an A-type personality, I want us to go incredibly fast, but, and that's okay, because it's still one woman. It's still, and it's now tens of thousands of women, and we're grateful for that, but it's still, you have to think about it individually, because that family, and we don't obviously know who they are because it's always blinded to us, but it's that family that now has the opportunity to have those women around, and those mothers or grandmothers or sisters around, and they can share life together, and that's important to me.
It's huge as well. I mean, the impact is huge behind what you're doing. So if you look at this journey that you've had so far, so from that being in that bar in Costa Rica and kind of like coming up with the idea, or putting the pieces of the jigsaw together to where you are today? What have been some of your major learnings on this journey?
Just keep going every single day, keep going. And, you have to plan accordingly, meet the right people, keep your mind open. Um, I had no intentions or thoughts that I would be starting an organization like HERHealthEQ. I also had no intentions or thoughts that I would be an entrepreneur. It was never in my mind to do that. But I mean, I was laid off from a company after 15 years in corporate, and I was ready for something new. And so I said, okay, great, I'll become a consultant. And it was something I never thought of. It's harder than I would have ever dreamed. And I think everyone needs to understand that's one of the biggest learnings. It looks amazing. It's very hard. It's harder than working in a corporation. It's, you don't have these systems around you. You don't have stability and security. You have to build that up over years. And I'm grateful, after 6-7 years that I've built this up. But it's hard every day. You have to sometimes do work that you're not so interested in. To get to the work that you are interested in doing, you have to pay your dues. You have to learn to work with teams that you never thought you would have worked with. And, you also learn what you like and what you don't like. There's
What,
certain things that, what?
I had to ask the question, what do you like and what don't you like?
um, I do not love business development. It is, I'm not incredibly good at it, and I recognize that. I don't really like it. I like doing the work. I love to do the work. I love to work with teams. I love to help companies out, but I hate like fishing for new business. I'm grateful now that a lot of it comes to me. Thank goodness. Obviously, because I'm good at what I do, but I that's just not my thing. I do love, especially in the HERHealthEQ side of things, I love piecing together partnerships and strategic alliances. That's fun for me. And I really don't like the day-to-day admin. I can fully say I don't like that, but I also like finding the solutions for people who do. I have virtual assistants. They
Yeah.
love that. They're good at it. And that's great. It takes the pressure off of me for having to do it. So, those are just some of the things that I love and don't love. But, I think that it's important to understand that you can't be good and can't like everything. It's a waste of time if you do, because you're not having your gifts and your skills shine if you're doing things you don't love. I'm not saying every day is, unicorns and rainbows. It's just, on the grand scheme of things, you have to really like what you do, because that's your skills, and that's how it comes across, and that's how you present yourself and do your best work. And just some of the few learnings. I have also learned that the power of a network and the power of keeping up that network, and also just generally being a good person. I obviously don't talk to everybody every single day, and it could be years between a conversation, but if you've always had a good relationship with them and a rapport, you can pick up and start to talk to them again, and maybe there's a connection to be made for something that you're doing in the future. Like, again, I had no idea that I was starting this organization. Now, 5 years later, I'm connecting with people because I want to talk to their organization about donation of product to HERHealthEQ. I want to talk to them about supply chain. I want to talk to them about logistics. These are not things that I would have ever thought through 5, 10, 15 years ago, earlier in my career. And I think it's important to network with a lot of different people that you just wouldn't think would be interesting, and useful. But listen, everybody's career continues to grow. And so you never know where they're going to be, and they're never going to know where you're going to be and how it's going to interact in the future. I was just hired recently by a client, somebody that I worked for 15 years ago.
Wow.
It's one of those things like, They moved companies 4 times. I obviously moved companies many times, have my own company. And we just never thought paths were crossed. But, on LinkedIn, said something, this is what I've been doing lately. And somebody's like, oh, great. I need some help with this.
Yeah. Yeah.
And here you go. And that's how the connections happen. I mean, it was 15 years that we've worked together, and we're totally two completely different people because we've grown. But I think that's the power of a network, and it's a power to keep that up. And it's not always about what you need. It could be about what they need. It could just be like touching base and keeping up with somebody. And it's simple, like, you can like a post or on LinkedIn, or you can just reach out and say, like, congrats on the new job, or that's exciting, or a great article, all these different things. And that's just a way to stay in touch, because it keeps you top of mind, and it also puts them top of mind to you. Like your body, your brain remembers these things.
It's such an interesting point you make about LinkedIn, because I remember, I've been doing recruitment for almost 9 years now. And so I remember LinkedIn 9 years ago, and it was a totally different platform. It was literally, you'd go there to put your CV if you were looking for a job. And it's migrated now to this like professional network that's becoming so much more like a professional version of Facebook or Instagram, and LinkedIn stories has just come out, so like there's just so much of that, and it's made the world a smaller place professionally. It's just so easy to connect with people globally and to nurture those kind of relationships, and also to keep up to date on what other people in your network are doing. And as you said, it doesn't take a lot of time, but nurturing those relationships is absolutely critical, especially if you're trying to build something yourself for the long term. One thing that you said a while back regarding business development, I just wanted to come back on that point, because I know that quite a lot of people in our network that listen to this podcast, a lot of them are probably employed by a corporate company, but right now a lot of people are also having conversations with us around, like, should I go freelance or should I become a consultant? And typically by background, a lot of these people may be slightly more introverted, engineering backgrounds also, as you said. I put out a post on LinkedIn recently saying the one thing you need to know about becoming a consultant is that you need to do business development. Sales is part of that cycle. So when you kind of came into that as somebody who maybe just didn't really enjoy it that much, who maybe has a similar background to some of our listeners, what worked well for you in terms of being able to build your brand and get customers and do business development?
Yeah, it's an interesting topic for sure. So I started to reach out to people that I knew, knowing what my expertise were, and saying, like, hey, by the way, went on my own. Let me know if you have any, projects. I also started to network with certain companies and different people to say, okay, like, this is what I'm doing. I could work in your company for 6 months or a year doing this role until you find somebody that you want to hire full time. So that's a good way to start. Another way is there's platforms to get on. And so in the States, and I think it's global now, Catalent is one, Aconnect is another one, Slidebooks. There's a lot of different ones that are they act as placement agencies for high performing, very desirable consultants. So you can start to build up your brand that way. And you have to start on small projects. You have to, again, do things that you might not typically do, or you might think that are a little beneath you, but all of a sudden you get, you have a big name client, and nobody needs to know, exactly what the work you did for them. But you need to go and build out your clients as well. And so, I've worked with companies that I don't know if I ever would have gotten myself if I wasn't working with some of these other larger organizations. I also see the value in partnering with other consultants. So if you're starting out and there's an established consultant that does work similar, you can be an add-on. How about you work with them on a project, or you pitch certain projects? If you know of something that's happening, but you are not fully able to do it yourself, and maybe it needs a team of 2 or 3, you bring in other people who are experts that maybe they have a little bit more gravitas to their client portfolio, to their CV, and you pitch it together. So that gives you the experience, it gives you the learning. I also think it's really important to almost be an entrepreneur within the companies that you're working in. So, something that we've talked about before is this entrepreneur model. And so I think that's an interesting way to start kind of building your brain up to be an entrepreneur. But just to go back to the original question, you really have to network. I think also being a thought leader. So start posting content, and not just reposting and posting content. Come up with some ideas of your own. You also have to figure out what your niche is. I started with a pretty small niche, and then I've expanded it since then. I started with just working on outsourcing and offshoring. And so I built up my client base through that. And then I was able to expand it because I had significant clients working throughout, that industry, and it kind of built up my name and my brand. And then I moved into strategy and moved into strategic work with a lot of these companies to help them grow. So, that was something that I did. You also take experience from what you had in the past. If you did, like me, mergers and acquisitions within a company, great. You're an expert in mergers and acquisitions, or a subset of that. If you did product development, yeah, great. You can do that externally. There's a huge demand for that right now, actually. And, also, again, go back to your network. Like, go back to people who you used to work with and you had relationships with. Tell them what you're doing, and um, and let everybody know that this is something that you're thinking about, that you're exploring, and that you're interested to start doing. And maybe start it small. Start with like what everybody calls a side hustle.
Yep.
Start it small. Do it at night. Do it on weekends. Do it when you can, and do things that you potentially could do then. And so it's a great way to start. And it's you have to build yourself and your brand up. And those are just a few ways you could potentially do that.
Yeah, because a lot of people kind of think, hey, shall I just like leave my job and then start this company, and then clients will come to me because I'm announcing, hey, I'm now freelance. And it's actually not the case, right? Like,
oh no, it's like the worst.
We always say to people, like, that is not the way that we recommend. But exactly as you said, like, build it up on the side, build relationships, network. And especially, like, if you are doing that, then start with the more operational stuff in the end, because everybody wants to become a freelancer to do strategic work. And as you said, like, you kind of need to build a portfolio of experience to be able to do strategic work. You need to be able to say, look, I helped these companies, and you build relationships internally within the companies, and then you can start to upgrade the services that you offer them. And it is a grind, right? Like, it is hard work. So one thing that comes to mind when you're talking, you've obviously got these two businesses. I know you do advisory stuff on the side. You have the stuff with the startups as well. You're doing TED Talks. You're all over the world. Something that I would love to know is, like, how do you actually go about organizing yourself when you're super busy? How do you actually do it? How do you manage your time?
So I color code my schedule. So, you'll find out that I have like 7 email addresses. And I use them for very different things. And so each one has a different color code in my calendar. So that's kind of helpful. It seems ridiculous, but like when I look at my calendar, I can then I shift my brain based on the color. And so, purple is HERHealthEQ. Green is consulting. I have certain client accounts, and those have different colors as well. So I can shift my brain between them. I also block out times. So I say, I'm going to work on HERHealthEQ for 3 hours at this time. I'm going to work with this client for 5 hours on this. I like to plan the schedule. I also like to have flexibility in it because yesterday it was snowing here in New York, and I wanted to go play in the snow for an hour. You need to make sure you have time to do that. But the way that I kind of organize is that every quarter I create a high level focus and goals, and I put them into buckets. So I have a bucket for HERHealthEQ, a bucket for consulting and advisory work. I have a bucket for life. And then I look at that. It's like posted on my refrigerator. I carry it around in my notebook with me everywhere I go. I look at it every day. And then I look at my calendar and to say, okay, am I doing everything that I should be doing in alignment with those goals? And that, those back up to, I have a 3 to 5 year goal, then I'd break it out into annual goals and then, quarterly goals. Every week I have a to-do list and I look at it to make sure that there's not something on there that is like so completely random that has nothing to do with any of those.
Mm.
And I do keep time, and it's important to keep time for like open time because you need thinking time. You also need time to explore different options. I mean, I've just recently joined as a venture partner at a firm, and it was not something that was like in the plan. It was something that makes sense. I'm really excited about. It points to developing countries and especially health innovations. So, given what I do, why would I not, why would I not entertain that conversation? And now, now it's led to this. And I think like you have to just make sure everything aligns to like what you want in life. And so I manage my schedule based on color codes. I do make sure that there's time off. And as a serial entrepreneur and as anybody going through any of this journey or thinking about this journey, I can tell you I work 24 hours a day because I feel like my brain doesn't stop even when I'm sleeping.
Yep.
That's just probably because I'm not a good sleeper. Or there's so much to think about at 3 o'clock in the morning, I guess. And but you can you can work every hour of every day of every week of every month, but you have to take the time to like sit down and whether it's spending time with your family or watching a ridiculous movie on TV or just going for a walk. That's when ideas happen.
Yeah.
That's when, and that's also when things all come together. I would never have dreamed that doing what I'm doing now, I would never have pieced it together 5, 6, 7 years ago. Never in my life. And I don't know necessarily what's going to happen in the future in the next 5 to 10 years. I have an idea of where I'd like it to go, but every conversation has the potential to bring it closer or to take it further away from that. And so I think you have to just like be very strategic in your time and be very strategic in what is interesting to you. There's a million great ideas out there. And
Mm.
I'm not saying no to any of them, but if they don't make sense for me and where I want to go in life, like I just have to say it's a great idea. I love it. It's just personally not for me. Um, I think education is so incredibly important because obviously we're doing what we're doing to make sure girls go to school. But I'm not in ed tech. I'm not interested in ed tech. But there's tons of people who are. It's just not me.
Mm.
And if I know them, I'll connect you to them. And like I think that's what you have to think about when you look at like a lot of requests or emails or I want to talk to you or ways to manage your schedule. It comes back to, does everything that you're doing go towards where you want to go
Yeah.
in life?
It's this idea of relevancy. And so
Yes.
everybody's heard of like a SMART goal, right?
Yes.
But I can't remember who came up with the idea. It was probably a big consulting firm. But the idea is SMART goal, but then smarter with an R on the end.
Yes.
And that
Yes.
R stands for, is this relevant? So yes, it's specific, measurable, all that kind of stuff. But then, is it actually relevant to the bigger picture that I'm aiming towards? Because you might have a great SMART goal, but if it doesn't get you in the right direction of where you're trying to go, it's not even relevant for you to be doing it. And I think that's so important. And I learned that only recently. And so that's something that I start to apply now to everything. Like, is this relevant for us in what we're trying to do?
Mm-hmm.
If yes, proceed. If no, be ruthless about it. And, it don't go there. But goals, it's really interesting to hear that you're like so structured and that you have these goals, but then you have the flexibility as well. You're kind of like, I have my 5-year plan, but then I don't know if I'm going to be there. How important has goal setting been for you in your career?
It's so important. I think I'm also a person who loves to check stuff off and hit those achievements and make those milestones. So for me, it's important. It's not just about checking them off. It's about doing the work to say that you can check them off.
Mhm.
And so I think goals are important. They're a guiding light. It's not the only thing in life, because you have to keep your eyes open to see, like you're saying, into the little R, like into this relevancy R, because a goal is important. A big arching goal is important to understand the vision for what you want your life to be, what you want to be working on. Absolutely important. You're going to have deviations, absolutely, and you're going to get there probably in a different way. Again, I had no ambitions of starting two companies ever in my lifetime. I had no idea of being freelance, like and an entrepreneur. Never had a plan in my entire life until I did it. I'm grateful I did it, and I know that I was meant to do it. But when I was 13, never did I think that this would have been my life. And so I had goals of, seeing the world, traveling, helping people, exploration, things like that. Like, have these goals of, and maybe now, it's relevant to have financial goals. Well, that's great. How are you going to get there? You have travel goals, you have experience goals, you have, charitable goals. You have to figure out how you're going to get there. If you make more money, you can be more charitable.
Mm.
So if you want to be more charitable, then make more money. Like, figure out how this all ties together. Charity doesn't have to be, and philanthropy doesn't have to necessarily be just giving money. You can give time.
Yeah.
You can be on a board. I started on a board before I started my own company of a nonprofit organization. I wanted to understand what that looked like. As I was about to start one, I said, I should probably get on a board to understand that structure.
Yeah.
So goals are really important because it sets up like how you want to go. But I just always want to put that caution in, like, don't be so narrow-minded to not allow other ideas and outside information into your brain, because that's probably how you're going to get to your goal in just a different way of how you envisioned it. And I'm not saying, like, there's certain people who are like very focused on goals and they're great at achieving them. And if that works for you, then absolutely, that's great. I just like outside thoughts, and it could be a goal. I want to be the head sales in a region. That's great. But if you didn't know that this other hospital just opened up because you were so narrow-minded on just the big hospital, you probably wouldn't have hit your goals.
Mm.
So, it's within your massive goals. How do you keep your eyes open to be able to achieve them? And I'm a huge goal person, goal setting. And it's not just a check on a list. It's because you want to get to a certain place. And then what's the next goal after that?
Yeah.
And why do you want those goals? There has to be I always like to tie a why to certain goals. So the fact that I want to, achieve a financial return, every year of X, I want to do that so that I can do something else, so that I can have a house in Italy, so I can travel the world, so that I can give back, so that I can help other people, so that I can take a year off and, whatever, volunteer somewhere. That's why those things, to me personally, are important. And I think you have to always have your goal, but understand why. And it might be you want that because you want stability for your family and you want to send your kids to university. And everyone has their different reason, but if you have a why to it, it also makes it easier to keep going every single day.
Yeah.
I mean, you have to know why you're doing something. It's not just to check something off the list. You do it for a reason.
Yeah.
And that's what you always have to think about. And I can't wait to get back on airplanes. And I do, and I'm working so hard now because we're not able to get on planes right now. So I might as well just work so that when we are able to, and it's safe to, I'm probably not working for 3 months.
Yeah.
Because I've been working nonstop for 10 months.
I think it's really is critical in order to really like give yourself direction as well. And that's that why gives you the sense of purpose behind what you're doing.
Absolutely.
And that's the thing that like when it gets tough, and when you're like, oh, I don't want to get out of bed because, you know, like whatever, I had a bad day yesterday, like that purpose and the reason why you're doing it is the thing that will get you out of bed. And that's really the difference between waking up in the morning and actually pushing through when things get tough, and giving up and saying, actually, you know, this is too tough, I'm going to do something else. It's that self-understanding of what's pushing me to actually do this.
Yeah. And it's okay to stay in bed for that one day, but the next day you wake up and you have to keep going.
Yeah. So let's talk about goals, because I'm conscious of the time. This is such a fascinating conversation. I feel like I could talk to you for like hours.
Well, yeah, let's do it.
We might need to do a part 2. So what excites you about 2021? So one goal for 2021, big goal for you?
My biggest goal is to launch our first revenue generating program in India for the detection of breast cancer in 30 different different clinics and areas. So it's a very aggressive program. It's the first population-based breast cancer screening that's going to be implemented in India. It's going to be a project that we do with her, in HERHealthEQ in conjunction with some other organizations and companies. And it's a huge step for us. So that's my biggest goal of the year. And then to build upon that. So we have several different other projects and opportunities in the pipeline right behind it, where we're going to be launching our our quote unquote new marketplace on how we can get equipment into different countries in different areas and different disease states. And so that's a really hefty goal of mine. And the other one is we're planning to be raising $1 million for HERHealthEQ, and it's an impact investment raise, and it just enables us to further our work, which is really important to me. And I know you asked for one, and I just gave you 14 of them, but but I really want also to help to continue helping the companies that I advise, that I'm on the board of, and that and I really want them to succeed because I'm behind their technology. I don't just advise for anybody. I am very strategic on it, and so I want these companies to do well because I'm behind the technology, and it's going to impact the lives of so many millions of women, and that's really important for me.
I think it's just testament of this idea of how everything is linked for you. It's not just like separate goals, but everything is kind of all linked together in the bigger picture. So the final question I always ask everyone, and I'm really looking forward to your answer, is what is the legacy that you want to leave on the world?
Wow, that's a stumper. I really want to ensure that women have access to healthcare, so that they can lead and live healthy lives. And so I just want to be one part of the solution. We have a hefty goal of treating and serving 1 million women by the end of 2025. And if we can achieve that, honestly, even if we achieve that in 20 years, that would be miraculous. But, I'm very aggressive in it. So if we can do that, that would be an incredible legacy to lead behind, and then also to build upon. So I just I would always hope that the person who solves cancer is directly impacted because we were able to impact the lives of their mother and them or themselves, or they were able to go to school or something like that, or a Nobel Prize winner or something like that. But in reality, I want people to have the same life that I was blessed to have. And if they don't have their health, they're not able to have that life or an opportunity to have that life. And so for me, that's the legacy I want to leave behind. I would love to put us out of a job, quite honestly. I would love for us to be irrelevant in many years to come. And that's my hope, really, as a legacy. So I don't know. It's a tough question. It really is. It's a good one. It's a tough one.
answer though as well. And I mean, all the best of luck to you, Marissa. I think, you know, if anyone's going to get there, you're 100% going to get there. It's been really, really interesting learning about your story and what you're doing and the mechanics behind it. Thank you everybody for listening to this episode. Please follow Marissa. She's very active on LinkedIn and she's always putting out content. And if you just want something to be inspired by, just follow her, which is what I'm doing anyway. And thank you all so much for joining, and join me again. Give this one a like if you like this episode, and reach out to Marissa if you have questions. I'm sure she'd be happy to hear your comments. And I will see you on another episode of Career Diaries by Elamed. Thank you, Marissa Fayer, and have a lovely rest of your day, everyone. Bye-bye.
Bye.